Go ahead.
Recreational marijuana legalization. The state of marijuana use in the United States is a heavily debated issue, as both proponents and opponents of marijuana usage actively express their voices. In 33 states, medicinal marijuana has been legalized. In 33 medicinal marijuana has been legalized, and in 10 recreational marijuana has been legalized. This has caused an increased prevalence of marijuana usage in the United States, asking us to evaluate the question of whether the federal government should be involved, which is currently not involved.
So marijuana has two active compounds, tetrahydrocannabinol, which is THC, and cannabidiol, which is CBD. THC is responsible for the body high that many users experience while using marijuana, and CBD is responsible for the medicinal and soothing properties, and is typically what's referred to when professionals say the term medical marijuana.
This led to our research question, should the U.S. federal government legalize recreational marijuana?
So we had three potential solutions. The first one was to fully legalize recreational marijuana with no limit on THC or CBD amounts. The second one was to legalize recreational marijuana with a 15% limit on THC and no limit on CBD. And the third one was to not legalize recreational marijuana, including THC and CBD.
So our solution was that the federal government should legalize recreational marijuana with a maximum of 15% THC. So medically, the effects of marijuana on consumer health depend greatly on the prevalence of THC and CBD in a given strain. So THC typically has negative effects on consumer health. So first of all, compromised brain function occurs. As found by a study done by Oxford University, spatial awareness, which is a person's ability to perceive the events occurring around them, was severely decreased when THC was present in the system, and this led to the development of false memories in which users couldn't differentiate between things that had actually happened while they were on the drug and things that they'd imagined. After years of consistent use, this was also found to be true in the long-term memory, meaning that complete brain function was affected due to THC use. Additionally, not only brain function is affected, but also physical abnormalities. So the hippocampal circuitries in the temporal lobe of the brain, after 3 years of consistent marijuana use during the teenage years, led to a deformed hippocampal circuitry by the early 20s, which is huge. On the other hand, CBD has very beneficial effects on consumer health. So first of all, it's proved to be very effective in the treatment of many diseases. First of all, epilepsy, which has no other core treatment for the symptoms of the disease, was found by University of Alabama Medical School to respond to CBD treatment with a lower seizure rate. Lung hyperresponsiveness was also decreased. So in people with asthma, this means the disease was very, very much easier for them to deal with. And in otherwise healthy individuals, this meant that stress was reduced and other relaxative properties were felt, which is why many people use CBD. Additionally, according to an epilepsy and behavior study, CBD has a very low abuse potential, and that was when it was tested with a synopsis of highly sensitive polydrug users. So the fact that they had no abuse reaction to CBD means that it's relatively safe. And this is what led us to put a cap on THC, since it negatively impacts consumer health, and no cap on CBD since it's beneficial for users.
In the political lens, 52% of all drug arrests in 2010 were related to marijuana possession, and if we federally legalize marijuana, recidivism rates would decrease. Additionally, Internal Revenue Code Section 280E states that marijuana manufacturers have to pay taxes on both their income and their expenses. This was meant for black market businesses, but it largely fails because these businesses fall under the radar, and legal businesses in legal states are made to pay these exorbitant taxes. And this prevents them from overtaking the illegal industry, which they would be able to do if this section was rescinded when marijuana was federally legalized. Internal spillover effects are also seen as Colorado was recently sued by its neighbor states of Nebraska and Oklahoma for spillover effects of marijuana into these two states where marijuana is illegal. If federal legalization was approved, then this would not be an issue anymore because uniform legislation would be reached throughout the United States. Tax revenue is a huge benefit that comes from marijuana legalization, and in Colorado, they made $2 million in the first month of legalization, and it steadily increased, and 2 years later, they were making over $12 million per month off of marijuana tax. This solution is more beneficial than the status quo because many of the same issues would occur, like high taxes for legal marijuana businesses, spillover effects, and taxes for the common man because they would have to support the jail system and arrests caused by marijuana possession. And if there was no cap on THC, that would lead to more crimes because increased amounts of THC leads to more clouded judgment. This would be a limitation of our solution. However, smuggled marijuana amounts would decrease because the legal industry would proliferate, and tax revenue could exact change in society, as seen by how Colorado pledged the first $45 million of their marijuana tax revenue to improving public schools.
Socially, our solution is also ideal for a few reasons. When first considering the pros, it's clear that marijuana is a lot safer than some currently legal solutions. As stated by the National Institute on Drug Abuse in this photo, marijuana is most comparable to caffeine and is much safer than both alcohol and nicotine, all of which are legal substances. And marijuana tested highest for its intoxication potential, which would be lower with our solution, as THC is the intoxicating agent in marijuana. Also, our solution would satisfy current users socially, as our proposed 15% of THC falls within the range of currently THC-dominant use strains recreationally. While it is slightly lower than average, it would still provide the consumer with a high and the experience that they are ultimately trying to reach. Lastly, the majority of adults want legalization of recreational marijuana. In a survey done by Statista, it was found that 2/3 of American adults want legalization of recreational marijuana, while 1/3 do not. While our solution directly caters to this 2/3 that wants legalization, as marijuana would be legalized, it also caters to this 1/3 as we are introducing marijuana in a more controlled and reliable way into society. Also, it's important to consider the cons of other solutions. First of all, with no limit on THC, there's a greater threat to adolescents, as adolescents would have access to higher dangerous strains of THC marijuana as they would be a part of their drug culture, as marijuana is currently found in many teenagers' lives at any moment. Additionally, with a complete ban on marijuana, users would not be able to access the drug of choice, even if it's legal in their current state government, and it's more dangerous if they have to obtain it through illegal ways. Also, it's important to consider the implications and limitations. First of all, for implications, there is an easier route to obtaining recreational marijuana if our solution was to go into place. But also, there could be more backlash for ethical and moral reasons. As found in the Journal of Drug Issues, there is a possibility for people with more salient religious beliefs and ethical reservations to not want marijuana to be a part of their society. Also, there are certain limitations, as the retail market would be greatly changed, as medicinal marijuana dispensaries and recreational marijuana dispensaries would have to be enforced by the government. And lastly, it's possible for illegal strains to still be distributed, as there is ways around current legislature even now.
If we were to look at the issue economically, our solution provides us with the highest possible amount of revenue while still taking safety into account. For as long as marijuana remains illegal in the United States, the government is unable to collect taxes from the drug. And considering that marijuana is currently the most commonly used drug in the country, we can expect that the imposed taxes will significantly benefit the economic state of the nation. A model created by the Marijuana Policy Group found that legalization in Colorado not only provided the state with over 18,000 jobs in 2015, but also earned them nearly $996 million. They found that marijuana tax revenue was 14% greater than casinos and 3 times higher than alcohol. They also predict the industry's revenue to surpass cigarette revenue by 2020, as shown by the graph above. If we were to legalize recreational marijuana completely, while we can expect to receive plenty of tax revenue and no marijuana prohibition costs, marijuana-related hospitalizations increased by 70% from 2013 to 2015, and this costed nearly $350 million that year. On the other hand, if we were to completely ban recreational marijuana, not only would we not receive any tax revenue whatsoever, but we would also be required to continue to support prosecuted and imprisoned people from marijuana use, which was estimated to cost $7.7 billion, according to Jeffrey Myron, an economics professor at Harvard. The economic implication of our solution, however, is an estimated annual revenue of $6.2 billion if taxed similarly to alcohol and tobacco. The limitation of this, on the other hand, is that the government is still required to regulate higher THC concentrations of the drug. However, this is estimated to cost far less than what we are currently spending to completely prohibit the drug. In summary, some of the primary limitations and implications that we addressed is that enforcement of marijuana use would still be required even with our solution, and illegal strains could still be found in society. Also, lower THC levels do still affect the body, and this could cause social unrest, However, this also would lead to fewer smokers.
The pros of our solution include more tax revenue for the government, lower incarceration rates, and less THC is safer for the human body. Other solutions would be less optimal because medical care and law enforcement spending would increase, and if there was no cap on THC, there would be a higher effect on the body and more arrests.
Also, in conclusion, our solution is the most viable solution. It's the safest possible way to integrate marijuana into society and is most agreed upon by society as a whole. Also, the money earned from tax revenues can go forward to better our nation and go forward to better enforcement ways that would have to be put in place with our solution.
Okay, good job. Caitlin, explain how your group decided to include Gabby's perspective into the overall presentation.
So Gabby's perspective had a lot to do with social concerns and social opinions about the drug. And since marijuana has been such a mainstream drug in society in recent years, this led to a lot of opinions coming out on all sides of the spectrum, which it helped us arrive at the solution of kind of keeping it in the middle without going to the extreme of fully legalizing recreational marijuana or fully banning it, since that would be the most pleasing to people socially.
Right. Gabby, give one specific way that your thinking changed as a result of learning about Caitlin's findings.
One way my thinking changed from learning about Caitlin's findings is that I previously did not know that there was such different effects between CBD and THC. So by learning about her findings, I was really more aware of that there's a difference between the two and that by altering the amount in the drug that we legalize, we could be changing the effect on people. And I previously did not know that was possible.
All right, Jasmine, what is the effect of, what is an example of a compelling argument from one of your peer individual reports that you decided to exclude from the presentation?
Well, one thing that Gabby mentioned in her IRR was racial stigmas that surround marijuana use, especially among different socioeconomic classes. However, this overall did weaken our argument, and we decided not to include it, as none of us really addressed that same issue of socioeconomic classes, and we just didn't find that it contributed much to our argument.
Last but certainly not least, having finished your project, what, if anything, do you consider to be a gap in your team's research that, if addressed, would make your conclusion stronger?
If we addressed medical marijuana, our research would have been stronger because medical marijuana would have certain benefits and drawbacks to it that we would have to take into consideration when we thought about legalizing marijuana. But we decided to go forward with recreational marijuana because it was a less research topic and it's less legalized throughout the United States.
All right.